18-year-old trainee jockey Cherie was riding a 600-kilogram racehorse when it reared up and fell back on her while she was still in the saddle.
And when she was found, her leg was pointing in a different direction, which is very suggestive that she's fractured her pelvis. Emergency physicians in general are really scared of pelvic injuries because they're really unpredictable. Somebody can come in talking to you, looking fine, and the next minute they're dying.
Cherie was practicing track work when the accident happened.
Riding a racehorse and he went up and flipped over on me. Usually I get out of the way of them.
Cherie's mum, Natalie, works close to the racecourse. When co-workers alerted her, she rushed to her daughter's side to wait for the air ambulance.
Mum's on her way.
Natalie's now driving 300 kilometres to the Royal Melbourne, unaware of how serious Cherie's injuries are.
Inside your pelvis, there's lots of arteries and veins that transmit a large volume of blood. If they are injured in the process of your pelvis being injured, you can bleed to death very, very rapidly. So we need to get a CT scan to make sure that she doesn't have any bleeding in her abdomen, her liver or her spleen or her bladder.
Please breathe in and hold your breath.
Oh, it's a fracture. I'll go and have a look at it.
At the moment, she doesn't seem to have any bleeding in her abdomen. There don't seem to be any other organs that are obviously injured, but we need a bit more time to be sure about what's going on.
She's definitely got that fracture that we could see. So I couldn't see that one on the plain X-ray, and then the one that we saw on the X-rays there.
The fractures could be career-ending for the aspiring jockey.
Hey, so you did fracture your pelvis?
I did fracture it.
Yep. So when the horse has come down, it's just squashed it and it's just popped open a little bit, okay? So there's a couple of bones in there that are broken. We just need to make a plan for what that needs.
Okay.
Okay? Oh, shit house day. So many injuries, even every now and again, one of them matters more.
Yep.
My immediate concern when I am dealing with somebody with a pelvic fracture like this is whether or not Cherie is going to make it out of my department alive.
So we're going to get you some pain relief, and then we're going to pop a different binder on over the top.
At the Royal Melbourne Hospital, trainee jockey Cherie has just learned she's broken her pelvis in a shocking riding accident when her 600-kilogram racehorse reared up and fell on her.
It's going to be a bit sore.
The injury could end the 18-year-old's dream career, but emergency doctor Maya Cubitt has graver concerns.
These types of injuries are potentially life-threatening. You can die from a fractured pelvis of this nature. So I'm going to hold on to your head while these guys fiddle with all of this stuff.
Cherie's accident happened at a country racetrack 300 kilometres away.
Were you due for some races?
No, not a jockey yet.
Ah, training.
Yeah.
A broken pelvis is devastating for Cherie, whose mum Natalie is driving over 3 hours to be with her daughter.
Emergency departments are really scary places, and if you haven't got somebody there to advocate for you, it can be a pretty lonely place. So it's important that we're all cognizant of how she might be feeling and give her the things that she needs, not only for her injuries, but for her emotional safety.
If you cut across the bottom of her pants, Bruce, you should be able to pull the majority of them off.
To minimise moving Cherie and risking further injury, her jodhpurs have to be cut off.
They're great pants. They look expensive.
They are expensive.
Yeah, I know.
Could happen yesterday when I was wearing Kmart jeans.
Yeah, it always happens when you're wearing the really expensive ones.
Yep.
When people give us a smile, it makes us realise that we're gaining trust. She's really frightened, she's in pain, and she needs to be able to feel like the people that own control of what's going on in the room, she can trust.
There you go. Can you grab me some on Dancerton, please? Yeah. Thank you.
Do you feel like you actually need to vomit?
Sort of just feel a little bit uneasy.
Yeah.
Cherie takes a sudden turn for the worse.
We roll people when they tell us that they're nauseated because we want the vomit to go onto the floor and not into their lungs.
So I would rather not roll you if we don't have to. I think it's important, in fact, that we don't.
Cherie is not displaying any signs that there is ongoing bleeding in her pelvis. Sometimes that's because there's a clot that has formed over the area. The last thing we want to do is dislodge the clot, which puts her at risk of catastrophic bleeding.
Over in Trauma Bay 1, Dr. Maya Cupid wants to avoid the risk of triggering bleeding in 18-year-old Cherie's broken pelvis.
So I don't want you to vomit on your back. But the less moving around we do, the better.
The trainee jockey was riding a 600-kilogram racehorse when it reared up and fell back on her.
Have a sniff of this. It's a bit of a weird thing, but it helps take away the sense of vomit.
That's a great idea.
So one of our nurses gives Cherie an alcohol swab. There was a study a few years ago that showed that sniffing an alcohol swab is quite a good, what we call antiemetic, or an anti-nausea drug, where we can give it to the patient themselves to hold and they can sniff it, and often it resolves their nausea.
How you doing?
Oh, there.
And look, here come the bone doctors.
Cherie's been waiting anxiously to hear what surgery she'll need. Orthopaedic surgeon John Rayner has some difficult news to break to her.
So you've got a pretty major injury to your pelvis.
Yeah.
Okay, so when the horse has fallen on you, what the images look like is it's giving you a combination injury of squashing it that way and squashing it that way. Okay, and that's why your legs are pointing sort of in this direction. What that requires is an operation to fix the front and the back of the pelvis.
Getting a description about major surgery is really confronting. I suspect patients like Cherie take very little of it in. So the most important thing we can do is to try to give little pieces of information and give them often.
We obviously won't proceed with anything before you have a chat to Mum.
Yeah.
Okay. You're in the right place. We do this a lot. We'll look after you. I know it's pretty scary though, having an operation. But the idea is to try and get you up and walking. Might be a little while though, fortunately.
It's a major operation and could shatter Cherie's dreams of being a jockey.
I'm a little bit upset.
I think whenever we're delivering news of any significance, we would prefer somebody to have a person there to support them. In Cherie's case, that would obviously be her mum. But I don't think that we would not give her the information while waiting for her mum to arrive, because obviously it's her body and we've got her stuck on a bed and she's in a lot of pain and she needs to know why.
After a heart-wrenching 300-kilometre drive, Cherie's mum Natalie has finally arrived.
We live not even 2 minutes from the airport, so we often see and hear the air ambulance taking off, and every time you sort of hear it, your heart stops a little bit, doesn't it? And you sort of never expect that it'll be your kid going for a little helicopter trip. Yeah, so it was pretty scary when I got the call.
Yeah, it's very overwhelming. Just nothing's ever happened this bad before.
So the next thing that will happen is they'll try and get some surgery done.
Cherie's operation will determine whether her hope of one day riding a champion will ever come true.
Cherie's particular pelvic injury is actually really rare, and I am astounded that Cherie is not more unwell. And the bones themselves, we can either plate them back together or do an operation with some pins, but the ligaments take a lot longer to heal, and that healing will require significantly decreased activity, and horse riding would definitely be out.
When young trainee jockey Cherie's 600-kilogram horse fell on her, it broke her pelvis.
She's definitely got that fracture that we could see. Yeah.
She's now recovering from surgery.
It was all, wasn't actually unstable, the pelvis. It was still stable, so it didn't need the screws or plates. And they just manipulated it all back into place manually, and it's all back into place now. Yeah, it was just so good to hear that it wasn't as bad as what they thought. My mum's definitely relieved. Took a lot of weight off her shoulders.
The accident put Cherie's dream to be a jockey on hold, but she's still hopeful.
Yeah, so Mum's pretty happy with the outcome now. So she's gone home just to make sure everything's ready to get the rehab underway so I can get home.